everyone, we are going live. Hello everyone, good evening. My name is Putri. So welcome to Alpha IVF Women Specialist Facebook and Instagram live session. So today we have Miss Naomi to discuss about what is SMART IVF is all about. So if you are interested and have any questions regarding SMART IVF, do stay tuned and kindly leave your questions in the comment section below and we will answer your questions carefully. So Miss Naomi, can you explain to me what is IVF?
Alright, thank you, Putri. I'm Sapna's Naomi. Alright, Alright, so what is IVF? Alright, in IVF, in layman's term, it is a test tube baby. So a woman has to go through a series of injections to harvest your eggs, inject with your husband's sperm, fertilize into embryo, and we'll grow your embryo in the lab for 5 to 6 days and we transfer the embryo back inside your womb. So at this point, an embryo is transferred into the womb in hopes of achieving pregnancy. So in IVF, there are 5 basic steps. Number 1 is ovulation induction, where we stimulate the development of the healthy eggs in the ovaries. So these eggs are retrieved through a minor surgical procedure under an ultrasound imaging guidance with the use of a hollow needle. So sedation and local anesthesia is provided to reduce any discomfort. And then the sperm are usually obtained by ejaculation, followed by a series of sperm preparation. And then we go through the insemination of the sperm and eggs in the culture dish. So the eggs are monitored to confirm that fertilization and the cell division are taking place. So once successful, these fertilized eggs are considered embryos. So the embryo is then transferred into the woman's womb, and in 3 to 5 days later, after the egg retrieval. But in most cases, the transfer often occurs after the 5th day, which is the blastocyst stage. So any remaining embryos may be frozen for future use, but often these embryos or blastocysts are frozen and then transferred later, which in maybe a month or years later, depending on the couple's decision.
So, Naomi, what is the success rate for IVF in IVF women specialists?
All right, to date, our world-class IVF has achieved success rates of 82.9%, trusting us amongst the top IVF centers worldwide.
Then how long does one IVF a cycle process take?
So, on average, one IVF cycle takes about 4 to 6 weeks to complete. So, however, this will depend on the type of treatment that you are having and your individual response to the medication given.
So, basically, what are the total cost of IVF? Because normally it's quite expensive.
Yeah. So, right, in Alpha IVF, we invest heavily into these latest technologies and innovative treatment methods that can bring in the highest IVF treatment results. Thus, the standard IVF cost total ranges from 55,000 ringgit to 55,000 ringgit if PGS is involved. So, you may ask,
what is actually PGS?
Alright, PGS is a short term for pre-implantation genetic screening. So it is used to analyze the chromosomes of the embryo before they are transferred to the womb. So this actually increases the chance of getting pregnant and also decreases the risk of miscarriages.
That's quite impressive. Thank you for the information, Naomi. But I heard that Alpha offer this one program which is Smart IVF. So what is the difference between Smart IVF and the standard IVF?
Alright. Um, for those who just newly joined us, welcome. Since today's topic is about SMART IVF, if you want to know more, stay tuned with us to get to know this promotion that we are having. And yeah, so as we've understand about the basic IVF process that we mentioned earlier, so let's continue with this SMART IVF program. So yes, we do offer Smart IVF program, which is applicable to all Malaysians. So good news to all Malaysian couple. This Smart IVF is a design protocol to optimize your chance to become a parent, but with an affordable IVF, full IVF regime. So we have two options. This first package is for female below 37 years old, which is for a total of 13,000 ringgit, 888 ringgit. And for female below 37 and 38, it is 14,888 ringgit. So this program is tailored for ideally younger patients to anticipate their response to be educated with the comprehensive treatment plan given. So the difference in the age and the cost given is to account for a higher stimulation dose. So hence the eligibility for this program will be confirmed by your doctor upon your first assessment, as this program is targeted to women with good prognosis to begin with. So what is considered a good prognosis, right? So basically, women with good prognosis shall be you are below 38 years old with a minimum of 10 antral follicle count or more. If you have regular periods with no underlying gynae issues like PCO, or you have produced good quality embryos in your previous IVF cycles but failed to implant. So this good prognosis falls on the basic requirement that's needed for women to for the couple to sign up for this smart IVF. Yeah, and also this package covers all of the doctor's fee, the medications, the basic blood test, the OPU program, ICSI, Blastocyst, fresh embryo transfer procedure, the legal support, and until the day that you get your blood check test for your pregnancy test, which is the beta HCG, which is 10 days after your embryo transfer date.
So wow, the cost is quite reasonable compared to a standard IVF. So personally, do you think that this is a good opportunity for Malaysian to try this Smart IVF program?
Yes, I really do think that it is a good opportunity for a Malaysian couple, as this is really reasonable price provided for them. So when this couple, if you are eligible, once you're eligible, you have the access to the most innovative treatments administered with personalized service to help to achieve high pregnancy outcomes with the lowest cost spent, which is the aim of our objectives for this Smart IVF program. So with such package, right, is patients also get to enjoy our latest revolutionary techniques just as a standard IVF process. So these revolutionary techniques includes our piezo ICSI, which is compared to a conventional ICSI. Piezo ICSI uses a finer injection tip, and the injection tip is blunt compared to a sharp, rather than a sharp tip. So the possibility of damaging the egg is reduced. Another one we have is the Blastocyst Culture. So it is a valuable tool to facilitate the selection of the best quality embryo that most likely rise to a pregnancy, because blastocysts are more advanced and more likely to implant. So this reduces the risk of multiple pregnancies such as triplets. And lastly, we do have EmbryoScope Plus. It is a next generation of time-lapse system that is used to carefully monitor and analyze the development of every embryo. So this aids in the selection of the best quality embryo for transfer based on the cell division patterns at the time points. Other than that, the medications used in Smart IVF are no different with the standard IVF. So, like I mentioned before, it is targeted for younger women with good prognosis, right? So, This MyVF is with a cap of stimulation dosage of 200 units maximum, so which is considered an average stimulation dosage for a standard IVF. So, for example, let's say you want to try some clothing, so you would choose the one that is fit to your size. So it's the same like Smart IVF. Once you are eligible and it's actually fit for you, this Smart IVF is actually to is adequate to achieve a potentially better outcome for the ones that are eligible. So yeah, and this allows your doctor to pursue the most effective treatment simulation for you. So hence, this bundle approach removes the pressure of making decision based solely on just the cost price. Yeah. So in Smart IVF, we have two experienced and qualified doctors to assist you. We have Dr. Haris Hamza, which is a Malaysian pioneer on IVF and who delivered the first IVF Malaysian baby and also established a low-cost IVF program in Malaysia for Malaysian citizens since 2011. Another one, we have Dr. Lam Wei Kian, who has helped many couples that are struggling to conceive, including the Tengku Aziza Fertility Foundation, or TAF. So, Putri, to conclude, the take-home message on Smart IVF is to help couples to actually achieve a higher take-home baby rate at a lower cost and faster with our revolutionary techniques such as the PiezoXC, the Blastocyst Culture, and EmbryoScope Plus.
Thank you, Naomi, for the detailed explanation. Okay, as a nurse, do you personally think that how do you encourage people to come and seek for fertility specialists? Yeah,
Alright.
for consultation, especially for those who are so shy and actually this is the first time. So how do we encourage these people to come?
Alright, so for patients who are first timer who have never tried any fertility treatment before, so we actually do have counseling session before you see the doctor, and this counseling session is to allow you to have the opportunity to have an in-depth understanding on the implications of each and every treatment that was suggested to you as necessary information, guidance, and support. So in our counseling, we allow you to talk freely and openly without the feeling of being judged, and then whatever that to also to have an in-depth understanding of the factors that may be contributing to your difficulties before and also after your pregnancy, and anything that you share with us with the counselor will be actually treated as private and confidential.
Okay, we do have questions here. Okay, does this package include the egg freeze cost?
Alright, so okay, this package does not include the egg freezing cost. So any extra charges the patient will need to pay the difference.
So another question is, if I have PCOS, how much will it cost if not include PGS? Is PGS is necessary?
Okay, for patient, if you have PCOS, I'm sorry, but this smart IVF will not be suitable for you. But standard IVF is actually uh, is suitable. Is this that you may take up a standard IVF program. That so for PGS, I would say it was not necessary, but it all depends on your age, and from the first assessment, doctor will suggest what is suitable for you and what is optional for you.
And then what will be the cost for the egg freezing?
Alright. So the cost of egg freezing, it actually depends. What will be the cost for egg freezing? Alright, the egg freezing it depends on how many eggs is in like egg freezing or embryo freezing. Egg freezing. Alright, egg freezing it depends on how many eggs you have and how many eggs are retrieved on that day. So it will all depends on how many eggs that you have in your ovaries.
Okay. So another question is, how much is the assessment if before start the smart IVF? Basically the consultations. Yeah.
All right, so the initial assessment will range from 600 to 700 for your first time visit, and this includes your semen analysis for your husband, uh, pelvic scan and abdominal scan for the female patient. So plus the consultation for the doctor. This is for the first initial assessment. So the price range from 600 to 700 ringgit.
Okay, Miss Naomi, we have another question. What is the cost for normal IVF? Okay, maybe that you can explain.
Yeah. All right, so the normal IVF, the cost in Alpha IVF Center for a standard IVF is 30 to 35,000, and like I said, if we included PGS, it can cost up to 50 to 55,000 ringgit.
Okay. So if you guys have any questions, just type in this comment section below. I will answer your questions accordingly. So, Miss Naomi, do you think like this that Smart IVF is actually good for couple to explore and come to our fertility to find out more details about this package?
So it's a it's actually a good opportunity for couples to actually know more about your your problems that you are experienced within that you are afraid to share outside. So once you come here and get your first assessment checked, and then from there, doctor will actually advise accordingly. So it is actually a good opportunity for you to have an open mind about what is what is a possible treatment plan for you.
Okay. And then, do you accept the first assessment result from other facility?
Yes, we actually do accept the assessment result from other facility as long as it is valid for the last 6 months. Otherwise. But for patient for Smart IVF, it is not applicable for the first assessment for you to get the assessment in other facility.
So basically, this Smart IVF is it's actually a program for Malaysia. So how about like the non-Malaysia? Do they get like any other promotions that they can go?
All right. So for non-Malaysians, Smart IVF program is not eligible. They are not eligible for this program. But if there is any other, if you want to know if you have any other promotion and any updates, just do follow us because we always we have for any latest updates in our social media as we keep updating our uh,
Yeah, we do have a lot of promotions from time to time. So you may check out our website, our Facebook, our Instagram, and then do follow our YouTube so you can stay update on our latest promotions. And then, okay, so Miss Naomi, can you like explain on about between PGS? Okay, so basically PGS is actually the latest method that we use to identify those embryos, right?
Alright, so okay, PGS is actually like is more of like to identify to make sure that to check for the chromosome to make sure that it's a complete chromosome before transfer. So it's actually a very famous method for a couple who has recurrent pregnancy failures, who have recurrent miscarriages, and this PGS is suitable for you once and suitable for you so that from there you will know that it is a normal embryo before the transfer, and then it will actually increase the chance of a successful pregnancy.
I see. Okay, then we do have like smart IVF is suitable for patients with endometriosis or NCIS.
Alright, so for this question, it is actually depends. You need to get your first assessment by the doctor before it is before to know that you are actually eligible for this program. It actually depends on your full medical condition. But endometriosis and cyst is actually acceptable, but you still need to go through assessment by the doctors to know that if you are really eligible for this program.
Okay. So Miss Naomi, do you have any the tips for couple to increase their pregnancy chance. Yeah.
Any tips? All right. So for
Okay.
alright. So for a couple who wants to increase their chance for infertility, do maintain a healthy lifestyle. Uh, Make sure you take your supplements, your good your multivitamins, and also do get yourself checked up yearly, and from there you will know that from there you can increase your chance of fertility. And get your partner together with you to actually go for a checkup together, and you can see uh, who have you can find out the issues that which either one of you are having.
Yeah, that's so true. Okay, like especially like for couples who are planning to get married or and to want to start family. So do you like really suggest for this couple to actually come to our facility, our Alpha women specialist to actually do the assessment before they go?
Yes. Yeah, I do encourage couples who are trying to start a family to actually come here for assessment before so that you will know if there's any issue with you, so that you can have a smooth pregnancy planning.
Okay, so if there is no other question or our session has come to an end. So before we close, I hope that you have been benefit from today's session. If you have any questions or any inquiries, you can email to our inquiry at alphafacilitycenter.com, or you may follow us on Instagram, Facebook, or YouTube, or you can WhatsApp us. Okay. So thank you everyone for joining us today. Don't forget to like, follow, and subscribe our YouTube channel to receive our latest promotion. So do let us know if you have any other topic that you want us to talk about in future for our live session. Okay. Thank you everyone.
Thank you.